Neurosurgeon Dr. Gerald Schell has been performing minimally invasive surgical procedures for the treatment of low back pain using the Trans 1 system at St. Mary's of Michigan since the summer of 2007. Traditional surgery would often require several hours in the operating room, as well as several days of recovery at the hospital. This new procedure usually requires about 30 minutes in the surgery suite, and in some cases may be done as an outpatient.
Plastic spinal model here, and you can see this would be the tailbone, and the back of the body would be here, and the stomach here. The nerve tube goes through an opening here. There'll be muscles on either side, so there's no incision at all in the back. There's no manipulation about muscles. There's no weakening or removal of any of the bone in order to expose nerves, so there's no weakening of the spine by the procedure. And the disc, which is in front, this normally would collapse down. So if you can imagine, here you've already got the implant in, but if you can imagine this bone and this bone almost touching, when the disc is removed and the screw goes through the bone, it goes through, and then as it goes into this L5, it actually will open up the vertebrae, and the nerves which are coming out the side of the spine to go on the legs and buttock on the side, those nerves which were crimped down by a narrow opening are unpinched indirectly by bringing this whole segment up. And that relieves a lot of the leg pain, a lot of the buttock pain, and a chronic numbness in the lower extremities that people get when they walk and move. I think that the average surgical time for the usual instrumented lumbar fusion surgery, the traditional type surgeries, open surgeries, would be in the order of 3 to 4 hours. This particular procedure would be less than an hour. It means less risk of the length of time of surgery, less trauma to the tissues. There are pressure problems with surgery because the person would be lying on their stomach. I think the time a person is under anesthetic, the more time there has, there's lots of different types of, they're not major complications, but there are things where people don't feel well for quite some time if they're under prolonged anesthetic, and there's just tremendous advantages to shorten up the time a person's under general anesthesia.
Accurate. He has by far and away done more of these procedures in Michigan. You know, in a short, well, what we consider a short period of time. We're, again, a young company, but since July 31st, he has very easily done more of these procedures than anyone else in the country, in the United States. All our new hires, we're going through a great expansion period as a new company, a new public company right now. So all our new hires that are coming through the initial hire training are coming in to see Dr. Schell perform this procedure. Coming to Saginaw, Michigan to get a good jump start on the technical, clinical aspects of this procedure. And what better place to do it than here with the person who's doing the procedure, doing it very well, and having great patient outcomes.